And welcome back to the program here on Coastal Daybreak here on the Talk Station, 7:16 in the morning. And of course, it's Sugar Talk with Dr. K. Jean Lucas and Doctor's in the house. Good morning.
Good
How
morning.
are you?
I'm good.
All right, then we're going to do questions part 2, right?
Part 2 of questions.
Yeah,
We had a lot of questions. We had 75 questions.
That's really great.
That's a lot.
Yes, and a lot for somebody to write down. But here we are. This is our second time. You had your diabetes school in the April one in Swansboro, and now you're going to have another one in June coming up at the Flame in New Bern. But between now and then, the questions that were asked this past time, we'll answer them now.
So we're going to focus on treatment.
Okay.
There are a lot of questions about treatment and medications for type 2 diabetes. One of them is, why do you have to take metformin twice a day? And metformin is probably the first line of treatment for type 2 since
It's been
type
around
2.
a long time, right?
Long time. It was in Europe a long time before we got it. So we got it in the 80s. Europe had it in the 60s. So it's been around a long time. But it helps insulin resistance. So it's pretty much unique. There's not another medication like it. It helps you not get hungry. The question about medications being used multiple times a day, it sort of depends on how long they last in the body, because you'd like them to cover your body all day and keep your blood sugar down all day. So there's two forms of metformin. One is just the short-acting metformin, which only works for 4 to 6 hours. And then there's the metformin ER, XR, which is extended release, and that's a bigger pill. And it slowly releases the metformin through the whole day and night. And since metformin keeps the liver from making sugar at night, you'd like it to work through the night and not let your liver, make sugar all night so your morning sugar's high. So sometimes you have to take it twice a day. If it's short acting, long acting, you can take it all once a day. But it's like 4 big pills once a day. Most people would rather not swallow all those.
Yes, that's
fills
right.
up their stomach. And so you can split them up if you're on the long acting, but you don't have to.
Is there an advantage to taking it like before bed or take it in the morning?
Usually take it with food because it can bother your stomach. So mainly metformin needs to be taken when you eat. Like have food in your stomach when you take it, especially the short-acting version. But the main problem with metformin is the stomach problems, like diarrhea is the main one. And as you go up on the dose, then you can have more diarrhea or nausea. So what you do is you start with a little dose and work up, and if you have any problems with it, go back down. So if you need to tell your doctor that you're having diarrhea, you just don't put up with it, and you certainly don't go up on the dose if you have any side effects from a smaller dose.
But taking it with food in your stomach, see, these days a lot of people that don't eat breakfast, that probably makes it later in the day when they take it.
Well, that's another issue.
That's another issue, yes.
You could take it all at supper time. If you don't eat breakfast. Lunch is hard to remember, so forget that. Just take it. And if you forget to take it like with supper, you can take it right after, because the food stays in your stomach probably about 2 hours. So you have food in there still. I think people forget about that. Bedtime is fine to take it then, especially the long acting. The long acting you can take any time. You just want to have food in your stomach so you can not get nauseated with it.
Okay. All right. So again, that's part of question number 2 here too, about whether you take it before or after a meal.
Right. So you could take it after. It doesn't matter really. But if it's short acting, you want to take it with it so it starts working pretty quick.
Okay. Now what's the next one?
The difference between Janumet and metformin. Janumet, and there's lots of medications that have met on the end. So met stands for metformin. So Janumet is Januvia plus metformin, and that's another way you can get around having side effects from metformin, is that if it's mixed with another medication, it's usually coded. So you can have it with Januvia if you need a second medication, or you can take it with another like there's Zigdua, which is metformin and Farxiga. There's Invocamet, which is Invokana and metformin. There's Combiglize, doesn't have met on the end, but it's Onglyza and metformin. So you can mix metformin with anything, any other medicine, oral medicine for diabetes, and it doesn't cause as many side effects. And sometimes you need both medicines, because some medicines might help that spike after meals, and metformin may help you overnight. And so you want to mix them together.
Instead of taking Januvia and metformin, you would take a combo because of the way it's manufactured.
Well, it's less pills.
Yeah. Okay.
So you go from 5 pills to 2 pills. Might be helpful.
Yeah. Okay.
But and you can get Janumet XR, which is the long-acting metformin, and then regular Janumet, which is the short-acting metformin. So That's the combination that's been around, I guess, the longest of all the other ones. But there's all the ones, any medicine you can think of for diabetes almost, you can get a combination with metformin.
Okay. All right. Now, number 4.
So if you take metformin and glipizide and your sugars are low, first of all, congratulations that you got your sugar down.
Got it down. Yeah, what's the problem there?
You can eat more. You can eat that ice cream if you want to have
Yeah.
low sugar. No, glipizide makes you make more insulin. So glipizide, glimepiride, glyburide, all the sulfonylurea drugs stimulate your pancreas to make more insulin. And so that's helpful if your sugar's really high. So by the time you take it and your sugars come down, you probably don't need the glipizide as much. And so you would cut back on that one. You would not cut back on the metformin. Metformin doesn't make your sugar too low. It just makes your own insulin work better. But glipizide actually makes you make more insulin, and glipizide doesn't know when you should make insulin. It just makes you make insulin all the time. And there's short-acting and long-acting glipizide also. But if you have two medicines together and you start having low blood sugars, it's time to cut back on the one that makes insulin.
Okay. All right. Again, consult with your physician for that one. This next one, I love it. So what if my medicines make me both hungry and not hungry at the same time? I can see that now.
That's probably good,
You
'cause
order
it
the March
cancels each
pizza
other
and you
out.
take one bite. Yeah. So.
Well, for example, metformin tends to make you less hungry, and not necessarily because you're nauseated. It just makes you less hungry, and because it lowers your insulin level. But then glipizide raises your insulin level, so it's going to make you hungrier. So drugs that raise your insulin level, like glipizide or glyburide or glimepiride, Amaryl, they make you make more insulin. And anything that makes you make more insulin makes you hungrier. So you can crave carbohydrates, crave sugar, crave bread with those medicines. Or if you take insulin, you're going to be hungry too. So anything that increases your insulin level in your body, whether it's a shot of insulin or a pill that makes you make more insulin, tends to make you hungrier. And things that make your sugar lower without increasing your insulin make you less hungry. So you'd like to only take stuff that makes you less hungry. But sometimes when your blood sugar is really, really high, it needs to come down, because a high sugar makes you hungry also. A low sugar makes you hungry, a high sugar makes you hungry. Transition from a high sugar to low sugar makes you hungry. So
Sounds like breathing makes you hungry.
yes, just having diabetes makes you hungry.
Yeah. All right. More to come in just a moment here on Coastal Daybreak here on the Talk Station with the Sugar Talk with Dr. K. Gene Lucas. If you'd like to ask your questions, 800-818-2255 or the local numbers.
247-7282 or 353-40.